Randy, one of the new treatments we've been doing the last 3 or 4 years is treating sleep apnea. Fortunately, the medical profession has come around as well and is making it much more known to their patients about how serious sleep apnea can become. A lot of those patients have CPAP machines, and they need them just for their health. But there's so many of those patients that they hate those CPAPs, or they can't wear them, or they can't get them adjusted.
But they do work.
They do work. They're great.
Have you ever had people that you've been able to take off?
Oh,
CPAP?
all the time.
Really?
All the time. But, you know, we encourage them to wear their CPAP if they can use it, but most of the time it's too uncomfortable. Their partner doesn't like it. It's too bulky to take on trips. They can't get it adjusted. There are just numerous reasons why they don't want to wear or won't wear their CPAP. And if they have it and it's sitting in the closet, it's not doing them any good. So what we offer is to make an approved appliance that helps helps their sleep apnea. It does the same thing.
Because it opens up the airway?
Opens up the airway. It keeps them from gasping for air. Many times it will stop their snoring. So a lot of times they can pack that appliance up, travel with it. It's not anything that their partner even knows that they have in their mouth, and it's very comfortable to wear, and the more importantly, it treats their sleep apnea.
So these are people that walk around all day, breathe just fine.
Right.
But when they lay down, their jaw kind of floats back? And then they can't, the airways block.
Exactly.
So you're just extending that jaw, and then they breathe.
That's right.
I mean, it seems like that's very logical that
it's a very simple way to treat it. You know, there's a lot more to it than that, but as far as the patient's concerned.
But is that the basic premise? You're opening up the airway?
That's exactly right. If they can get air in, then they don't wake up gasping for air, and therefore they don't have any result of medical problems because of that.
What about chronic snorers?
Many times it will help snoring as well, okay? So almost every time, every patient we've ever had were snorers as well, and they all say that the snoring either has stopped completely or has been minimized, and their spouses or partners really appreciate that.